Welcome to the Health Channel, all health, all the time. I'm Olga Villaverde, coming to you from the Baptist Health South Florida studios. Facial fillers gone wrong. We've all heard or seen people who've had a so-called botched procedure. You know what I'm talking about. So why exactly does this happen? Well, today on the Health Channel, we're going to be discussing the risks of using the wrong fillers and even the risks of using the right fillers in the wrong places. Lots to cover. Sometimes the effects may be minimal, but for others, using dangerous fillers can even put your life at risk, believe it or not. Joining us today to share his expertise on dermal fillers is Dr. John Martin, a plastic surgeon with a personal practice right here in South Florida. Welcome, doctor.
Oh, thank you so much. Really a pleasure to be here.
Pleasure to have you, sir, truly. First of all, let's talk about your specialty and I guess what led your passion into this specialty of yours?
Okay, well, I started in ophthalmology.
No, ophthalmology?
Ophthalmology first, yes.
Oh my goodness, which obviously is the eyes.
Was the eyes. And my dad's an ophthalmologist.
Okay.
So I started in that. Then I came down here to Bascom Palmer to do a fellowship in what they call oculofacial plastic surgery because I really love the plastic surgery part of ophthalmology. So initially we did just sort of around the eyes, droopy eyelids, then started to do more facial work as well. And certainly when you're doing this, fillers become a big part of our practice now because we're trying to add volume as people age.
Absolutely. And here in South Florida, we're seeing a lot of that, aren't we?
We're seeing an awful lot of it.
It's amazing how in some parts of the country, him and I were just talking about that before the show started. I said to him, because he's from Massachusetts,
right.
And a lot of people are very hush-hush when they get, like plastic surgery. But here in South Florida,
let it go. Let it rip.
Look what I just did. I want to show you my whole body. No big deal. No shame here in South Florida. I love that. All right, so tell me what you are seeing in South Florida currently. What is like the fad, the hot trends?
Well, certainly in South Florida, the biggest things are body work. The Brazilian butt lifts and the breast. In terms of faces, facelifts are certainly the #1 procedure, and eyes, but fillers are a major part of our practice now because as we age, a lot of people will lose some volume. The volume will fall down to here, so if you can sort of build up the cheeks, put some filler in the tear troughs, a lot of ways to rejuvenate just with fillers, and when done well, it looks very natural, can last a long time, and that's what people want is sort of non-surgical procedures that make them look younger.
Exactly, and it's quite immediate, I hear, with it. Well, I'm going to find out soon because he's probably going to tell me I need it. But from what my friends tell me, they really feel like within days people notice something like, oh, you look so refreshed. You look just like if you just went on vacation. Well,
it's great too because you walk out and you look younger, and you're right, you look more refreshed. If you don't have any bruising, within a day or two, you look completely natural.
All right, so injectable fillers for the face, really common, really up there in like top 2, if you will.
Yes, absolutely.
No doubt about it. Okay, we have a list of what dermal fillers can do from the American Society of Plastic Surgeons, and they can do a lot. I was actually surprised to see this yesterday when I saw the topic. Plump lips.
You see a lot of that in Miami. Maybe a little too plump a lot of times.
That's another hour of another show.
Exactly.
Enhance shallow contours, that would be in what area?
Right. For contours, some people, you want to fill up the cheeks to pull up, help with the nasolabial fold. Some people put it directly into the nasolabial fold. You can fill the outer cheek, which will help pull up the cheeks. You can enhance the jawline. So there are a lot of areas on the face that you can fill. Now, the big area now is what we call tear troughs, this dark area that people get. And by putting some volume in there, it helps decrease the appearance of the dark circles.
All right. Obviously, it softens facial creases and wrinkles, improves appearance of receded scars. Look at that.
Right. So if you have some acne scars or scars from anything, if you put some underneath it, you can lift that scar, help break up the scar tissue underneath, and it'll really just help the skin look softer and smoother. All
right. And you hit the last one as well.
Okay.
What's the difference between fillers and Botox? Because I think people get them confused.
People get them
right?
very confused.
I would think they're the same, but they're not.
They're not the same.
Okay.
Because fillers is a gel that you inject underneath the skin to fill in an area, whereas Botox or any of the botulinum toxins, what they're going to do, they're a paralytic agent. So they're for dynamic wrinkles. So for example, the frown lines, if you put some botulinum toxin up here, it's going to paralyze these muscles, just decrease their action, so it'll decrease the appearance of the wrinkles. But it only lasts for about 3 or 4 months. Now, the fillers can last anywhere from 6 months to several years, depending on the area.
Oh, wow.
For example, in the tear trough, there isn't a lot of movement there, so we've seen that last for even 6 to 8 years at times in some people.
Oh, that's fantastic. Now, what's, I guess, the benefit of doing injections versus surgery? Obviously, one of them is non-invasive, so that's one check.
Correct.
What's another one?
Well, the
less permanent?
Well, it's less permanent. The other thing about the good fillers is you can dissolve them. So let's say you put in a filler and you say, you know, I don't really like the way that looks. There's an enzyme we can inject, dissolves it within about 20 minutes.
Oh.
The other...
Like Shazam.
Shazam.
Goodbye.
Ba-boom. Yeah.
Let's try again.
And the other thing... Let's just, since I'm oculoplastics, let's say someone has dark circles. Doing surgery may not do anything for that patient, whereas the fillers may really produce a nice change. Or if someone has an area that they need some volume, surgery may not help as much as a filler. So for a lot of people, fillers are a much better option.
All right. I'd like to take a quick moment to remind our viewers, if you'd like to give us a call and you have a question for Dr. Martin, there's the phone number. Super easy, 855-796-4475. So today we're going to be focusing on when fillers have gone bad and some of the risks. But, you know, I love doing this, and I love Trivial Pursuit, and I love history. So let's talk about just when did this all begin, this filler fascination. I'm doing alliteration here.
Okay. Well, fillers really started, 100 years ago. And the first fillers were actually paraffin, wax.
Wax?
Wax. So those were the first fillers. But obviously they didn't work very well because with your body temperature, the wax would melt. But that was what they first started trying.
But it's a good idea. I can see the logic behind it.
Exactly. And then you could do fillers from other parts of the body. Take some fat from one place, put it into another. And we still do a lot of fat fillers. It's only been in about the last 15 to 20 years that we started to use something called hyaluronic acid. And that's a filler that substance is actually in your body. It's in your skin, it's in your joints. So they've taken it, made it into a gel, and that's the one that we use the most. That's the safest one that you can inject. You can't really be allergic to it. Some people may get some swelling, but that's the one that you can also dissolve out. There are also now some more permanent fillers, higher risk anytime you use a permanent filler because they're harder to take them out. You really have to excise them. So we try to stick more to the hyaluronic acid fillers because they're safer and you can dissolve them.
And we're going to talk more about those in our next segment, or throughout the show, I should say. I read one here, silicone injections. What about those? I know we're going to briefly talk about them later too, but just tell me now.
Right. Now, silicone injections, silicone is legal to use inside the eye after, if you have, let's say, a retinal detachment. But people have used it in an off-label fashion, which means you can take a microdroplet of silicone, let's say, and fill in a scar. And if you use a medical grade silicone and you do it correctly, you'll probably be okay. The big issue is people have gone another step further and said, well, if the silicone works, let me get some silicone from somewhere else. It's a non-medical grade silicone loaded with impurities, but they're putting large volumes, even up to, let's say, a half a liter for breasts, or a quarter, just way too much in the face, and then it creates a myriad of problems. And
that we're going to talk about in about 20 minutes. Stay tuned for that. We have some before and after pictures of some women who did this. You do not want to miss it. Big mistakes, and they needed to be remedied. So, and the dangers behind it as well. So that's going to be probably in about 25 minutes. When it comes to determining who is a candidate for dermal fillers, I do want to let our viewers know that the American Academy of Plastic Surgeon has the following guidelines. So here are some guidelines in case you're thinking of doing some fillers. Be physically healthy. That's paramount. That goes without saying, right? Don't smoke. What's the importance? Why?
Well, the smoking will create a certain amount of lines and wrinkles. It also decreases blood flow to the face. And it's just not a healthy lifestyle. So it's sort of like getting, if you're tan and sunburned all the time and you come in for work, you really need to change your lifestyle. And so smoking is just bad for your skin. And even the fillers probably are not going to last as long because you have decreased blood flow to the face. All
right. Obviously have a positive outlook, have realistic goals in mind. How many people come in, doctor, and just say, I want this, and you kind of go, wait, whoa.
Yeah, exactly. People come in and I'm like, okay, 10 tubes of filler later, you might look better.
I want to look like Jennifer Aniston.
Right. Some people, you really need realistic expectations with anything that you do in plastic surgery. But with fillers, you can definitely create some nice changes. But some people may be beyond the stage of fillers. And then you just have to say to them, it's not going to work. It's a waste of your money.
All right. I do want to cover quickly Sculptra. I heard about that one. What's that?
Sculptra is one of the fillers that we can inject, and it's more of, it creates a scaffolding for you to create your own collagen. So it's for people who have overall loss of volume in their face, and you can do a filler, the Sculptra, and we usually will do 2 or 3 injections like every month to 4 to 6 weeks. And what that does, the scaffolding of this product, you create new collagen around it, so you form your own collagen. So it's different than the other fillers that just are a volume replacement.
And let's talk about collagen for, I mean, we all know what collagen is. I see babies and I'm like, look at all that collagen when I see their cheeks. Why is it good for us? And of course, we're replenishing our bodies with it because we're losing it.
We lose the collagen, and you, especially smoking, will help get rid of your collagen. Sun exposure will help decrease your collagen. So what you want to do is produce more collagen, so that's how this works. Now, taking collagen by mouth or putting on a collagen cream is not going to make you produce more collagen. Lasers, the heat of a laser will make you stimulate more collagen, so you get more collagen production, and then things like the Sculptor and will make you produce more collagen.
All right, and I just celebrated a birthday, and I saw in the last year of my life that I lost more collagen. So there we go.
32, once again. That's good.
Oh, I love you, doctor. I love you. That's fantastic. Add 20 more years. All right. So when we come back, sometimes we see or hear of people who have botched fillers. So why exactly does this happen? Up next, we're going to hear about the risks of certain types of fillers and what happens when fillers go bad. You're watching the Health Channel. All health all the time, all smiles all the time on South Florida PBS. If you have a question for Dr. Martin, please call us using the toll-free number right there, 855-796-4475. And be sure to visit our website, allhealthtv.com. You can watch the Health Channel live stream wherever you go, and you can check out videos from previous episodes like this one. We'll be right back. Stay tuned.
C stands for cutting-edge research, clinical trials, and collaboration. Creating breakthrough treatments as Florida's only member of the Memorial Sloan Kettering Cancer Alliance. At Miami Cancer Institute, C also stands for Cure, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
No family history of cancer, and I sat in that waiting room talking to women, and there were about 10 of us, and I casually joked with another woman, I can't believe that 1 in 8 women will be diagnosed in breast cancer. There are 10 of us in this room today. I had a 4 and an 8-year-old and a husband to grow old with, and I didn't think that I thought my life was over. They were giving me life-changing, devastating news. But at the same time, they were giving me a plan. Okay, this is what we have. This is how we're going to treat it. Cancer treatment is ugly. The way Baptist treats you as a person is beautiful. I would not have lived long enough to get the diagnosis. Early detection saved my life.
My mother shaped me as an actor, as a musician, as a human being. So when she was diagnosed with colon cancer, it was like our entire family got cancer. And she died when she was only 56, so this is personal. And hopefully my heartbreak is your wake-up call. You can prevent colorectal cancer. If you're 50 or older, get screened. Screening saves lives.
Because of you, I felt hopeless.
I know it was a joke, but it still hurt me.
Because of you, I felt wanted and not alone in this world.
Because you said hi to me on the first day of school, I felt included, and I knew that I was going to be okay.
Welcome back to the Health Channel, all health, all the time. I'm Olga Villaverde, and with us is plastic surgeon Dr. John Martin. If you have a question for Dr. Martin, please give us a call. There's the toll-free number right there, 855-796-4475. We would certainly love to hear from you. So before the break, we briefly discussed silicone fillers. Now, is this something that is commonly used nowadays?
You know,
or no?
Medical grade silicone is only used occasionally, and not many doctors use it because it's pretty off-label, and there can be complications. But if it's done in what they call a microdroplet technique, you can fill in sort of some small acne scars, little scars along the face, and as long as it's done correctly, you should do fine. But there are very few people that do it because it's very off-label. And now silicone has created a huge issue because of people injecting large volumes, which will definitely create a problem.
All right, I know you brought us a little tube here with some, what is that right there?
This is medical grade silicone, but this little bottle is about $500 or $600. So when people are putting in, let's say, a liter of silicone, which is what people will do, this non-medical grade silicone, if they were using medical grade, it would cost you, what, you know, $10,000, $20,000. So instead, they go for a more economic alternative, which is non-medical grade silicone that you can probably get at the hardware store.
Oh my goodness, but that is an amount that's okay, right there?
Yeah, well, you would take out a teeny bit and use one little drop at a time.
So can you imagine what people are putting in?
Oh,
Just a comparison of that with what you just told us.
Yeah, it's crazy the amounts that they're adding to people's faces and to their bodies.
And the danger behind it?
Well, the main danger is it's loaded with impurities so that your body, sometimes initially you'll look pretty good, and then after about anywhere from a week to even 20 years, you'll get an inflammatory process going on. Then you'll start to get nodules, you'll start to get breakdown of the skin will die. Even from the initial injection, if it's injected in large quantities, let's say into someone's buttocks, if it gets into a vessel, you can die from what we call a silicone embolus into the lungs. People can become septic. We were talking about Betty, who had injections, just a slow amount of injections through the years, and eventually she became septic, which is an infection throughout her body, and that's what can happen. You just can't fight the infection because you have so much inflammation. Now, even if you don't get all that inflammation, you think about it, we have all this inflammatory debris in your body. What's happening to your body, and how is it going to fight that through the years?
And to remind our viewers, and we have a lot of Hispanic viewers out there, back in 2013, I think it was very sad. I was there. Betty Pino was a very famous, very well-known radio host. Beautiful voice, beautiful human being. And she passed away because of this back in 2013. It was a huge loss for the community of Miami. And
you'll see it even in, you know, people who are, we think, okay, is it only lower socioeconomic groups that are doing this to save money? But you see it in Hollywood, you know, actresses and actors who have injected this substance, and now all of a sudden they have all this heaviness down here, and you can't really get it out. So it's an interesting phenomenon that people are doing these things even when they have money to really afford good fillers. The real thing, exactly, and the good thing. Yeah. Go figure, go figure. Excuse me. Okay, so we have a video from the FDA that warns against the use of injectable silicone for large-scale body contouring. Take a look at this.
Warning, warning. Beware of anyone who offers to increase the size of any part of your body or change the shape of your body by injecting dermal fillers. These procedures can lead to serious health consequences and even death. Injectable dermal fillers are medical devices regulated by the U.S. Food and Drug Administration, but no injectable filler is FDA approved for large-scale body contouring or body enhancement. Unfortunately, one popular filler used for body contouring is injectable silicone. Silicone is a liquid that stays in the body permanently. It can travel throughout the body and cause serious health consequences, including permanent scarring or disfigurement, stroke, and even death. Many unapproved injections are done by unlicensed and unqualified providers and in non-medical settings like hotels and residences. The FDA has investigated numerous criminal cases involving unapproved dermal fillers, and many have ended in successful prosecutions. Don't be duped. Avoid danger and never get butt fillers, breast fillers, or fillers between your muscles, or any injectable filler for large-scale body enhancement.
Great advice there. I'd like to take a quick moment to remind our viewers that if you have a question for Dr. Martin, he's right here waiting for your questions on standby. You can call him using the toll-free number right here, 855-796-4475. What about using the silicone for, let's say, large-scale body enhancements, you know, like
This is where you really run into trouble, because what will happen, let's say that someone injects into your buttocks and they put a half a gallon of this filler. So initially it might look pretty good, but it's low viscosity. It's not a thick filler, so it can migrate down your legs. So they've had people who have had to have their legs amputated.
Oh my goodness.
It compresses the blood flow, so initially you might just have your ankle and your foot gone, and then your whole leg gets amputated, and eventually you will die from this. Same thing with breasts. People are putting in large volumes. People go to an apartment, let's say, and someone has these plastic containers loaded with silicone. You have to, red flags should be going off. You're in someone's apartment. It's a it's not a doctor injecting this.
I was going to say, what kind of doctor would do this, or what kind of person would do this?
Well, they usually say that there are medical professionals somewhere. And they'll say, oh, we've done this before. We've never had any complications with this. So, in our country, we use this all the time. The problem is these people then disappear. So, first of all, they wouldn't know how to take care of the problem because it's so complicated, but also they disappear, so they're gone. So they come in, they do these pumping parties where all these people come and they'll have their buttocks enlarged, they'll have their breasts enlarged. And like I said, maybe for a few days it'll look pretty good.
A pumping party?
Pumping party.
Ave Maria. Just the name alone would scare me.
Well, people buy into this, and it's all sorts of people. And in Miami, these large butts are very popular. And if you can't afford to have it done with, let's say, a fat injection, and you definitely can't do this with medical grade silicone, so they'll go somewhere where they can get it for a cheaper amount of money, but it's very, very high risk. And if you don't die immediately from an embolus from the silicone, down the road, you're definitely going to have problems.
My goodness, thank you for that warning, doctor. Okay, we do have a list of a few examples of some of the risks of silicone injections, and I think this has to do with the face, doctor. There could be bruising, swelling, pain, formation of hard nodules. Where?
Right. This is mostly in the face, although you can get it anywhere. But bruising from any injection, swelling, pain. The formation of hard nodules, that's what we see a lot of in my practice. People come in, and they come in with all these nodules in their face, and I'll say to them, what did you have injected? Frequently, they have no idea. And sometimes I'll say biopolymer. Well, biopolymer is it's an industrial grade silicone. It's a non-medical grade silicone. But because it has that name, it makes it sound like it's something legal. It's not legal. And so this is the sort of person, initially they'll do well, then they get this inflammatory nodule in their face, and then you have to try to do something to help them take care of those nodules. So that's probably the most common thing we see.
How long does it take for those problems to start arising? Months, days, weeks?
It can be anywhere from usually a few weeks to even 10, sometimes people are fine for 10 years, and then all of a sudden they'll start to get inflammatory nodules all over their face.
And correct me if I'm wrong, but unlike other fillers that will dissolve over time, obviously, this one does not, silicone.
This one does not. Silicone is basically going to sit in your face, and so sometimes you'll feel it and it feels okay. You can say, oh, you have something in here, but it's not inflammatory at this point, but you can still feel the nodule. Then down the road, all of a sudden this may grow and it can come and go. And so they'll say, oh, I got a cold, triggered an autoimmune reaction. All of a sudden they get nodules all over. They get a little better. These nodules may go away. So they can come and go. But once they come, sometimes you'll show some pictures. They don't go away. They just sit there like these concrete nodules underneath the skin.
Okay, I always like to say proof in the pudding. So let's show an image. And look at this, please, of a woman who had this filler. Tell me what happened, and oh my goodness, poor thing.
Right, and she had basically this industrial grade silicone all over her face. You can see it in the jowls, but you can especially see it in the lips. The lips are totally deformed, and this is a common area for people to do it. And initially it may look good. Then they start to get these lumps along their lid, and the lips sometimes, like in this woman, if you flipped her lip over, it would stay there. It would not flip back in. She'd have to push it up. So that's how much weight is in there from this silicone. So one thing you can do for this, sometimes we'll do something called a microfocused ultrasound. The heat will sometimes decrease the nodule. The other thing you can do if it's in the lips is actually cut it out. And you do an incision along the inside of the lip. You take out what it feels like a rock in there, and then you close it up. And they actually can look pretty good. And I think we have a picture of her too, where we've done the procedure, taken out the
We're going to show that in the next segment.
All right, perfect.
Which is when you helped her out, thank goodness.
Now it gets harder taking out stuff that's in, let's say, the cheeks, because you don't want to be doing incisions all over the place. So we try usually just to do some heat, but this is where people get the nodules. And they can get big nodules underneath the eyes, all over the face. The brows will fall if you've had it done up here because of the weight. So all of a sudden, everything is just falling.
So let me ask you something, just the emotional aspect of someone who said, okay, I want to look better, I want to, improve my look. For whatever reason she did it, and she comes and sees you. I mean, you know her personally, obviously. You helped her, but it must have been devastating for her.
Oh, it's horrible. And they're usually, frequently these people come in and they're in tears, and they'll say, I don't know why I did this.
Gosh.
I went into this apartment, I went into this hotel room and had this done. Everyone was doing it, and now they're kicking themselves because what they've done is basically irreversible. You can maybe make them look a little bit better, but they know that they've done some bad things. And it's all different groups. I've had teachers, I've had nurses, I've had all sorts of different, professionals come in and they say, what was I thinking? That I had this done, listening to my friend who said, oh, look at this, I had this permanent filler and it looks great. Well, it might look great for a week or 2 weeks, and then all of a sudden you're gonna pay the price for having that illegal filler put into your face.
I always say if it's too good to be true.
If you can get $500 breasts.
I would have done it already.
It's way too good to be true.
That's right. That's why I have nothing. Okay, we have a list of also some potential side effects with the good fillers. They're minor, but I just want to show our viewers.
Yeah, these are very common. A little bit of bruising if you hit a little vessel going in. Redness, you're working on the skin, so some people will get a little bit red. Swelling, definitely for the first day or two if you've put in a filler. It attracts water. That's really how it works. So everyone should swell the first couple of days. Pain is uncommon, but sometimes you're working right on the bone. It's a little bit, it can be a little bit painful for a day or two afterwards. And itching would be if you're just having a little bit of reaction to something that we cleaned with or just from the procedure itself.
And usually that just lasts a few days from what I hear.
All that goes away.
All right. Okay, great, doctor. Okay, so coming up next, we're going to talk about how botched fillers can be fixed. We're actually going to show a picture of this lady and how you fixed it, and hopefully she's doing better. We're going to look at the picture when we come back. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Dr. Martin, there's our toll-free number. So easy. Give us a call. Don't be shy. 855-796-4475. Don't forget to visit our website, allhealthtv.com. You can watch a live stream of the show 24/7 and check out videos from previous episodes. We'll be right back.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
If you're like me, when you have the flu, you don't want to go anywhere. And when your kid has it too, life is just awful.
And why should you go anywhere when you'll probably feel better just staying in bed anyway?
That's why Baptist Health's Care on Demand is so crucial. Care right from your bed.
How are you feeling today?
Yeah, we've been sick for a couple days now. I can even get my prescriptions ordered through my care provider after my visit. Hey, hon, could you pick that up at the pharmacy on your way home? And it's care right away, not hours of driving in the car and then sitting in a waiting room. Because when I have the flu, there's only one thing I feel like doing.
smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
Stuck in traffic? There's an easier way to see a doctor, right from your phone. Download the Baptist Health Care On Demand app today to enroll for free.
Hey there. So what's going on today? Can you open wide for me, buddy? Okay, I see what's happening.
Care On Demand from Baptist Health, the better way to get better.
The screenings that happen here might be fun or dramatic, but it's not real life. There's another screening that is real life, and it could save your life. It's a screening test for colorectal cancer, the second leading cancer killer of men and women. Screening finds precancerous polyps so they can be removed before they turn into cancer. I got screened. Now it's your turn, so you can stick around and enjoy the show.
If you're 50 or older, get screened for colorectal cancer.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us today is plastic surgeon Dr. John Martin. If you have a question for Dr. Martin, you can call us using the toll-free number right there, 855-796-4475. All right, so we're talking about botched cosmetic surgery. How treatable is it when a patient comes into you? I mean, I know every case is different.
Right. It's very difficult. It's very, very difficult because what happens when you inject these things is it's not just right underneath the skin. It has sort of penetrated all these different levels. So if you think of it as a sponge, you know, it's all different layers of the sponge. So under your skin, it might be in the fat, it's in the muscle, it's in all the subcutaneous tissue. So even though it feels like a distinct nodule, it's really everywhere. So if you want to take that out, you're going to take out pretty much everything that's underneath it, and then you're going to get a big hole.
And you told me it kind of feels like rocks sometimes.
It is like a rock. It's like concrete in there. So when you're cutting it out, it's very, very difficult to cut it out. And it creates a lot of bleeding, and it creates new scar tissue. So what we've been trying instead is something called a microfocused ultrasound. So it's very high intensity ultrasound. And what the ultrasound does is it delivers a deep heat in there to sort of break up some of the tissue so that hopefully your body can take care of it. In lips, it works actually pretty well. In some of the nodules, as long as they're not too big, it'll work fairly well there. We also do injections of anti-inflammatories to break up the inflammatory component. So in some patients, we can shrink this down, and at least they'll look better. But what can happen is they'll do great, let's say, for a year, and then all of a sudden, it can get inflamed again and come back. Then they have to come in for another treatment. So it's just a series of treatments. It never really goes away.
I was going to ask you that, because do they come in hopeful that you're just going to bring them back to what they were?
Yes.
Or is that just not a realistic goal?
It's not a realistic goal, but that's what
the damage is done.
Damage is done, but they all think, oh, just cut it out.
Just take it out.
Take it out, no big deal. And like, it doesn't work that way. You know, especially, let's say you have a big nodule here and I take it out. Well, now you have a big depression. Eventually, maybe we can put a little fat in there or something else, but it's also hard to get out all the product. So sometimes you think, okay, they're doing well, and it's all gone. And then a year later, all of a sudden it becomes inflamed again because it's very hard because it's everywhere. And they may have that nodule, but they may have little pieces of silicone in other places that you just didn't see or didn't feel.
So this is not like one and done. This takes time.
No. Oh, this is years and years of treatment.
So that injection that you put in, which was quick, now results into years and years of trying to repair it.
Yes. Absolutely.
Ave Maria. Oh my gosh. Okay, so does insurance cover something like this?
No.
So you paid for the job, which was cheap anyway.
Which was cheap, and now
you're going to pay big bucks for the mistake, which is not cheap at all.
And is not going to make you look great.
Oh my
It's going to make you look better, hopefully, but it's not necessarily going to make you look really good. Sometimes we're pretty lucky and people can get back towards where they were, but it's almost impossible to get people really looking good.
Are you left with scarring of some sorts?
Yeah. If you, like on one patient that we'll show, we did an incision over here to do sort of a facelift flap, lift it up, try to get out some of the stuff. We got out some of it, but it was like big concrete boulders in there. So we were able to kind of chip away at it, get some of it out. Looked better, but didn't look great. And then,
and when you see it, doctor, I mean, does it, oh my gosh, what does it look like in there?
Well, it looks sort of like coral rock, but it has all sorts of blood vessels in it. So as you're cutting it out, you get a lot of bleeding. So it's not an easy procedure. And if you come, let's say you do it through the skin, well, every time you take out something through the skin, you're going to get a scar. Now, this is an interesting case of someone who did it. And in the top left, what you see are these nodules that she had, and they're everywhere. This is the one that we went in and tried to take some of it out, and you can see it's better in the bottom. Then she went on to botched, and that's the top right. And you can see that it's a lot better, but that's, I will say that.
Look at, I mean, I'm looking at the one in the left. Look at that huge.
It's like a mountain in her face,
Oh my gosh, but that's, doctor, I mean, with all due respect, that is so much better, what you did for her.
Well, on the top is when she had a facelift, but it's also very soon afterwards. So she's a little swollen and looks pretty good. The bottom right shows a year later, and all of a sudden it's coming back again.
Oh my goodness. So that was a year later and it's coming back.
It's coming back. So you think you have it all out, but you don't. And so now we're going through the injections again and the heat again to try to get rid of whatever's in there. So it doesn't go away.
My goodness. Earlier we showed an image of a patient who went to see the doctor, Dr. Martin, and was really destroyed, emotional. Let's see what you did for her, and let's see the before and after.
This is just
wow.
This is just showing the lips. By taking it out, you get rid of those nodules, the smile is better, and her lips don't fall out anymore when she
could put them back in by herself.
She could put them back in by herself.
Oh my gosh.
And even the cheeks are better. They're not perfect, but definitely she's much happier with her smile, because that's what a lot of people are unhappy with, is the big nodules in your lip, and you just can't smile normally.
With all due respect, it is much better, and she must have been so
Yeah, she was very happy that at least now she had a nice smile.
Oh my goodness, thank goodness she went to go see you. Just a quick moment to show you our toll-free number in case you have a question for the doctor regarding fillers or plastic surgery for that matter, 855-796-4475. How soon do they see the results from the before and afters?
Well, from let's say excising the lips, they're pretty swollen for about a week or two, and then it looks pretty good. So it's just, that is a pretty quick fix. But that's the only fairly quick fix, is doing the lip excisions. Any of the other excisions, it takes much longer to heal. You get an inflammatory process both from the surgery and from whatever's in there. So that can take a while to heal, weeks at a time. So it's not quick.
No, it's not. Okay, so let's take a look at another patient of yours, before and after, and tell me about this story here.
Okay. This is a woman who actually went to a real doctor. And she had won a prize to get these injections into her face. So she had multiple injections.
Oh my gosh, poor thing.
Ended up getting all these different nodules on her face. And what we've done is gone in and tried to fix, because her lids were pulled down. She had all these different nodules in there. And what we've done is gone in, sort of tightened the lid, put some fat in, tried to take out the substance that's there. But we've done multiple surgeries to get to a point where she actually looks pretty good now.
So this is a real doctor that just really didn't know what he was doing, with all due respect, again?
Exactly. He was putting in a filler that was, I think it was FDA approved, but definitely not for under the eyelids. For under the eyelids, there's really nothing approved to put under the eyelids. But if we do put some of the hyaluronic acids in there in what we call off-label, but you can only even then put 1 or 2 of them in, because otherwise they get too swollen. So putting these other fillers in, really off-label and really not a good idea, because you get this chronic inflammatory response with nodules and scarring.
Can you imagine you win a prize? You go to a real doctor. Oh my goodness. All right. Wow. Let's look at another image of another patient and see what happened, what went wrong here. So
this is another woman, and she had a permanent fill put into her eyebrows and into her lips. And so what we did here was, it's a little harder to see, but above her brow, you see that big nodule?
I see it to the right.
Right. And so what we did is did an incision right over it, and it was really like a rock inside. I mean, you could definitely sort of say, okay, this is abnormal because it feels like a rock, take it out and then close it up. And she actually healed quite nicely. So, but not everyone heals well either. She scars well, so you don't see the scar. But now she came back because she has more down here in different areas of her face. And I said, hopefully it'll heal as well as you did around the eyebrows.
This must be something that's so difficult for patients. Again, self-esteem, mental health, coming in to see you, completely destroyed. And you can only do so much.
Right, a lot of tears. People send us pictures sometimes, and I say, Or let's say if it's in the breasts or in your buttocks. Here at least we can do the deep ultrasound to try to help. You can't really do that if you have these big breast nodules. The woman that had had the facelift and then it came back after a year, if you feel her breasts, you feel these large, hard lumps inside. So you know that there's an inflammatory process. And through the years, we all think that the breasts have gotten larger. So I think that there's this inflammation just creating more and more swelling inside the breast. So it's very, very difficult to treat.
Poor thing. So while Botox, isn't a filler, this is another type of injection that has potential complications. We have one more example of one patient who had injections on her lips. Oh, my word.
Right.
And that's how she was? Well, it's not funny, doctor. I mean.
Oh, what happened here was there's an injection you can put a little botulinum toxin down at the base underneath the lines, what we call the marionette lines, down underneath the lips. And she had a little bit too much on one side and not on the other. So one side is still working, one side isn't. So what you have to do is put some more in the other side. Now, this can definitely happen. You see it a lot even more with injections into the upper part of the face, where people will do injections up here and the brow will drop. So people come in and they're like this. Or you put some here to lift up the brow when people go too high, which is
the
actually,
deer in the headlights look.
Yeah, or the Dr. Spock look.
The Dr. Spock, I like that.
You can correct that by putting a little bit up here and dropping it. The bigger one is you put some up here, sometimes it can come down and people's eyelid will drop. And then
I've seen that.
There's a special drop that we use that'll help open the eye until it goes away. So the good thing about botulinum toxins is they only last for 3 months, so it's not a permanent problem. And most issues you can fix with a little bit more botulinum toxin. But you can definitely see complications. And every med spa in town is doing botulinum toxins, and you really need to have a good understanding of the anatomy to do it correctly.
And do you only see this with women, or do you see this with men also?
Oh, no, we see it with men too, certainly.
Okay, because we've only showcased women, so I'm just gonna...
Right, but guys especially, they have a heavy brow. You do up here for these deep lines, and all of a sudden they can't open their eyes because the brow is so low. So you have to explain that to patients. They all think, oh, I want to get rid of these lines, but you have to know what possible secondary effects they're going to have from doing those injections.
All right, we're going to take a quick break, and let me tell you, this next segment is the one you want to see, all right? Researching your doctor, why it's so important. Hello, and why certain board certifications really matter. So get a paper and pen to find out if you're going to get a filler, what doctor should you go see? Find out what to expect from your initial consultation, everything you need to know so you can leave looking fabulous and not like that with rocks. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Dr. Martin, there's the toll-free number, 855-796-4475. And don't forget that website, allhealthtv.com. You can watch a live stream of our show, and you can also check out previous episodes. We'll be right back with the research you need.
Did you know that people born from 1945 through 1965 have the highest rates of hepatitis C, but most don't know they're infected? People can live for decades without symptoms, but over time, hepatitis C can cause serious health problems. If you were born during these years, the CDC now recommends that you get a blood test for hepatitis C. So talk to your doctor and find out if you have hepatitis C. It could save your life. No more.
A brain aneurysm doesn't care if you're busy. It doesn't care that you have important meetings. It doesn't care that you have to drop your daughter off at ballet and your son off at soccer practice. And if you ignore the warning signs of a brain aneurysm, you'll realize too late that the meeting wasn't that important. No meeting is. That you'll never see another soccer game, and that your daughter won't see you in the audience at the big recital. So if you suddenly experience the worst headache of your life, sharp pain behind your eye, and blurry vision, don't ignore it. Seek immediate emergency care, because your family is counting on you to take care of you. The Lisa Calagrassi Foundation, shedding light on brain aneurysms. Learn more at lisafoundation.org.
Hi, I'm Janelle Hale, founder and CEO of the National Breast Cancer Foundation. No one should face breast cancer alone. When I was diagnosed 36 years ago, there was no internet, and I had to make a decision with little information. Early detection saved my life. It could save yours too. To learn what every woman needs to know about breast cancer, visit nbcf.org/hope.
It's been said that knowledge is power. So learn the warning signs of uterine cancer, like bleeding that's not normal for you, or unusual pelvic pain or pressure. Knowing is powerful, maybe even life-saving.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us today is plastic surgeon Dr. John Martin. If you have a question for Dr. Martin, there's our toll-free number right here, 855-796-4475. I'm actually thrilled to say that we have a caller. We actually have Tracy from Miami, and Tracy is the, oh my goodness, she was the one that won the prize and got all the bruising on her face. Hi, Tracy.
Hi.
How are you?
I'm live? Wait a minute, Dr.
Tracy.
Martin, I'm making a nice cappuccino for you.
Oh, nice. Oh, well, can I have one too, please?
Yes. This is how I start my morning, and so happy to see Dr. Martin there. He should be there.
Fantastic. So, Tracy, what happened? You go somewhere and you get this prize?
Yeah.
And the prize is?
It was a nothing more than stunning, non-invasive beauty makeover. 400 or 500 people went for the contest, people my age. I'm in my late 50s. So kind of preyed on the middle-agers, oh, good, something where I can, get a complete non-invasive. That was the most important word.
Right.
But it became very invasive because out of all those people, at 44, I wanted to go back into modeling, and I just needed a little rejuvenation, and that's what I thought I was getting. But I was injected
the doctor told me you were
many times with the illegal fillers, which I didn't find out for quite a long time until, everybody left town, so to speak.
So when you got the illegal fillers, obviously you don't know, people leave town. What do you start seeing? What starts transpiring in your face?
It did take a little while. Like Dr. Martin says, I'm a skinny girl, so anytime you fill something up, I look great. And so it was very swollen, but I did have immediate bad, like almost like I was internally bleeding, bruising, but it was flat. So I, actually went to my doctor thinking, something was wrong because I had such terrible bruising every time this guy would inject me, because the doctor tried to tell me it was my vegetarian diet, which it was not. So I don't mean to giggle now. It's been since 2006 I've been going through this.
Vegetarian diet, where does that come in?
It doesn't. Yeah.
It doesn't.
Blame something else. Yeah.
We have the picture.
In
We're looking at
blood,
all
I
the
don't know.
bruising. We're looking at all your bruising. This is how you obviously approached Dr. Martin. Dr. Martin, when you saw her, obviously you went, whoa.
Right. Tracy had already had some things done before she even came to me. And so we sort of, she'd been seen down at Bascom Palmer and some other places. So we were kind of picking up, working with them to try to figure out, okay, what can we do next? Because, they had taken out some of the filler, but there was still some in there. So we needed to try to go in and get out more. But as I said, every time you do that, then sometimes it'll pull the lid down, you get some scarring. So you're constantly working to try to make this look better.
Tracy, I have to ask you, I know the doctor was able to help you, thank goodness, and he told me you're looking fantastic, thank goodness. I know you were also Miss Maine at one point in your life.
1985, okay, Miss Maine USA, but yes, I'm talking to the little new one it's coming on in a few days, and the little new Miss Maine is like, she thinks I'm just amazing. She's like, what do I do? Give me some pointers. I said, stay away from fillers.
Oh, that's great advice. I'm going to look you up to see what you looked like way back when. But here's my question. When you saw all that happening, how devastated were you?
You know, it's been so long and so many emotions. But because Dr. Martin, when I went to him, I was pretty much, okay, this is the way I'm going to look. Because as we started to try to take it out, I became more deformed. And, you know, we have one area that we're still working on. Just to this day, it came out. We thought everything was better. And as we start to stimulate areas around the eyes, because not only did we have to do my eyes, but I got old. And 12 years later, you know, I'm 57 now, I had to have a neck lift. I had a brow lift. I had I had all the muscle taken out under my eyes. As he told you, you have to take out the filler with the muscle, which is why it was easier to access the eyelids as opposed to having had it anywhere else in my face. I did have some in my lips. He took it out of my lips. Everything bounced back. Things do bounce back when you take it out.
What a nightmare.
But in my case, yeah, it's been horrible. And if I did not have this blessed angel surgeon, because I was turned away by everybody, even the top of the top. Because a plastic surgeon is great. They tuck, they pull, they cut. But if you've got lumps and bumps and things going on in the skin or the muscle underneath, they can't pull.
No,
so Dr. Martin had to sort of like make the canvas all flat again.
Oh my
and
goodness.
that has been the chore.
Well, Tracy,
and without
you're a
him,
beautiful
I don't
person,
know
which
where
makes
I would.
it easier. Yeah.
That's right. You are beautiful inside and out. Thank you so much for calling us, Tracy. I'm glad things are back on track for you. And I'm going to look up Miss Maine back in what, 1985?
85. 1985. If you go to Google, I was there with Bob Barker and Joan Van Ark, and I really thought I was going to win, you know? But they gave me a bad perm, so.
All right. Thank you so much, sweetheart. Do appreciate it.
Don't go anywhere else. Bye-bye.
Agreed. Agreed. Thank you for the advice. 1985, Bob Barker. Love it. Okay, we only have a few minutes left in the show. I do want to go through some important information for our viewers, so I'm going to quickly do this because I think it's important for you all to know. Red flags. Let's show you some red flags in case you do go to a doctor. People should look out for this, doctor. One, identify substance in injections.
Right. This should come in a package that is labeled. It shouldn't be in an open bottle that you're taking stuff out. Have them discuss the risks and benefits. Don't get pressured into a treatment. If you're not ready, come back. Talk to other people. Have you had treatments? And, you know, you can ask how many units, but don't get hung up on that. Just make sure that the bottles that they're using are legal, approved bottles.
Okay, tries to pressure a treatment. Obviously, look out for that. Doesn't say how many units in injections. That's important too, right?
Yeah, but make sure it's a real bottle. And then if you're used to getting 40 units, well, hopefully it'll be 40 units again, you know, and just talk to the patient, you know, talk to your doctor. And make sure it's a doctor. Make sure they have a license to practice.
Proper board certification.
Yes.
How imperative is that?
Well, in Florida, I was telling you
that was funny. Go ahead, tell our viewers.
You know, in meetings, I give a lot of talks, and we talk, and everyone says that Miami is the Wild West of medicine because so many crazy things are done here.
That's the best Wild West of medicine.
I know. So you need to make sure that you're going to a licensed doctor. Try to find a board-certified doctor in the field where you're doing the work. If it's in plastic surgery, a plastic surgeon, oculofacial plastic surgeon, or a facial plastic surgeon, or dermatologist. We're all the specialists in doing these sort of injections. If you go to a med spa, you know, make sure that they're using legal products, and you know, but I would say find a doctor.
Absolutely.
Is definitely what I would say.
A good one, especially with like maybe a reputation for that matter. Let's talk about also the initial consultation. What should you expect? Let's show you a graph and we can walk you through this. This is really the courtesy that you deserve. Goals are talked about.
Right. You go in. What are you trying to achieve with these injections? Do you want bigger cheeks? Do you want bigger lips? Do you want to fill in your tear trough? Do you have any medical conditions that you shouldn't be doing injections? If you're pregnant, you don't want to be doing Botox. You know, certain diseases, you shouldn't be doing injections at all. What are the medications you're taking? We always ask people, medications and supplements. Do you smoke? You shouldn't be smoking anyway, but it decreases blood flow, especially for surgeries. You can definitely have problems. And have you had anything done in the past? It is amazing to me the number of people say, doctor, I've never had anything done. I'm like, well, what's this scar here? Oh, I forgot. I had a little facelift. Or what are these nodules that I can feel? Because sometimes I don't tell you, and I said, I feel nodules in your face. Oh yeah, I forgot I had some biopolymer injected before. So you have to really sort of be honest with your doctor about things you've had done.
And of course, like we mentioned before, a good surgeon will discuss always potential risks and complications. That's their job. They take the Hippocratic oath, right? Do no harm. So let's talk about the potential risk and complications.
And they should be able to show you pre and post pictures. That's very important too.
That's a great point.
What do you think I'm going to look like, especially with surgeries, pre and post patients? And sometimes they'll talk to other patients. What was the last thing you said? Risks and benefits?
Risk and benefits.
Okay.
You're supposed to discuss that with them.
Discuss the risks and benefits with patients.
And what's in your best interest too?
Right. Everything has a risk. Every procedure we do has a risk, and you really have to go over that with patients. Nothing is risk-free.
Okay, you got about 20 seconds. Final advice for anyone out there that's thinking of fillers.
Well, we were saying, if you're
Here we go.
Find someone who's licensed, use an approved filler. If you don't go to a pumping party. Well, we were saying, stay home and have a glass of wine. You really want to find someone who is a legal injector, and using legal products.
Fantastic. It's been so great having you.
It's been great.
You got to come back.
Absolutely.
That's been fun. I'm so glad Tracy called in. Miss Maine, 1985. She's looking fabulous
we'll get her
now.
back on the podium.
Yeah, hopefully, you know what? She should come on the show. That'd be fantastic. All right. So thank you so much for joining us. That's all the time we have here on the Health Channel. And as you know, it's All Health all the time on South Florida PBS. Follow us on Facebook and Twitter at All Health TV, where you can get health tips from our experts and see what's coming up on the show. You can also visit our website, allhealthtv.com. You can watch the Health Channel live stream and check out videos from previous episodes. So like the doctor said, if you get an invitation for a pumping party, do not RSVP. That's it. Stay home, have a glass of wine and a ribeye. Medium rare. I'm Olga Villaverde. We'll see you next time. Take care.